Welcome to Talk Purpose and Truth, shifting you into higher consciousness. A show that elevates, uplifts, and encourages listeners to grow, heal, awaken, and evolve. Eden and Kim include bold topics, interviews with inspiring guests, experts, and celebrities, intuitive readings, channeled messages, mental health awareness, and hot topics to expand your awareness. Tune in for unprecedented truth, authenticity, on-purpose discussions, and magic.
Before I introduce her, I want to just talk about why we're doing this episode. So we've had people on the show, including Judy Salgado Thurston, and we've had the recent episode on fentanyl and other episodes where people have talked about their husbands taking their own lives and things like that. And we haven't really specifically had an episode on grief and the different types of grief and how to handle or overcome or get through grief or anything like that. Yeah. And so we just thought, you know what, we want to find somebody who's an expert at this, among other interesting things. And we'll talk about how grief is experienced in many different ways and some of our own examples with that as well. And I was telling our guest that I was walking through the park like a month ago, and all of a sudden her name popped into my head. And I don't even think we've ever met. I think we just are Facebook connections and have mutual friends. Yeah. And out of nowhere, her name popped into my head. And that happens to me sometimes with intuition. And the message was like, contact her. It's really important. So I looked up her Facebook, and she happens to be an expert on grief, among other things we'll talk about. And I was like, oh my gosh, this is exactly what Eden and I were just saying. We wanted a guest on this. So I asked her. Luckily, we're blessed that she could do it. So yes. I love how the universe works.
We just put it, I just ask for what you want, right?
Yes. Yeah. With the belief that you'll get it and the vision you'll get it. So, okay, so Dr. Gretchen Kubacky is a health psychologist, grief expert, and she is a best-selling author and speaker. And she'll tell us, but she has books available on Amazon, among other places, and very excited to talk more about everything she does. So welcome, Dr. Gretchen.
Thank you.
And did I say that
here? Pardon?
Did I say it correctly, your last name?
Yes.
Perfect.
That's why everyone calls me Gretchen.
Oh, yeah. That's a cool name. So tell us your journey with your career and purpose and some of your experiences that led you to what you do.
Okay. I always had an interest in psychology. My mom was a psych major in college. And so when I was a kid, I'd read her books and just found them fascinating. Didn't do that for a career initially, but when I was in my 30s, I went back to grad school and became licensed as a psychologist and certified bereavement facilitator. And what led me there was having a lot of a complex family with a lot of trauma in it. I lost both my father and my brother to suicide at separate times. And so I developed a specialty in grief and loss, particularly what we call complicated bereavement, and specifically with suicide loss, but I also work with a lot of homicide loss, multiple miscarriages, other forms of really difficult loss. And I have always had a keen interest in health issues as well. I was kind of one of those weird kids, like reading the Merck manual for fun.
You're not weird, or I'm weird too, because I did the same thing.
Awesome.
Okay.
So I was always fascinated with medical stuff, but I was not great at science classes. And so I found that I could do health psychology, where I get to deal with health content and get to read and study health content and work with people on health problems in the psychological context. And a lot of people have chronic or invisible illnesses, or they're dealing with, at this point, a lot of rare illnesses, or individuals who have multiple chronic overlapping illnesses, but they look totally fine. And so there's a lot of psychological struggle around all of that. So that's how I came into my career.
Okay. And how can one grieve a loss that's not, well, it can either be the loss of a loved one or other losses, like as if they're ill, a chronic illness, having a chronic illness, or the loss of a relationship. How does explain how you grieve that and how you work through it? What are your tips?
Sure. First of all, most people think that there is a set path for grieving, but it's not. Like we'd like to think there's kind of, you start at the bottom and you go straight up to the top and then you're great again. What really happens is it kind of looks like a mess, right? And you have all the feelings all the time, some feelings none of the time. Sometimes you're just flat and blank. So what I like to do is try and help people kind of establish where they were originally, identifying what their goals and their values are in life after the loss. And then we can start orienting towards choosing activities that support living. Along the way, there's a lot of time spent going through the things that are scary, discouraging, the real losses, right? So sometimes people have lost abilities, they may have lost body parts, they've lost family members, they've lost job opportunities because of an illness. With death, you may have lost social standing or certain roles in your life. So any of those things may be different for different people. And we go through what is highest priority, what seems most troubling, kind of getting stable again, and then figuring out how to maximize living through orienting around the goals that are important to them.
Okay, so it's not necessarily forgetting the person who you lost, or trying to erase them from your mind or erase the situation.
Absolutely not.
How to cope with it.
No. One of the things that people sometimes are scared about coming into grief therapy is that they will forget the person that they lost. It is not possible.
Yeah.
It is not possible to actually forget the person that you've lost. And that, I think, is a really important reassurance, because we're not really taught how to grieve, and particularly in American culture, in white Christian-oriented culture. It's a very sanitized and distanced process of dealing with death and dying. And we don't have a lot of cultural support for actually identifying our feelings or honoring people in the way that we want to honor them when we've lost them. So I really like to work with people's cultural traditions and maybe to introduce ideas about things that they can do to actually have an active memorial of their loved one.
Wow, I love that. It's like speaking or behaving and acting into one's listenings or one's alignment.
Yeah.
Yeah, everyone has a little bit of a different grief process. The thing that also comes up a lot is there are many traumas that people go through in life. Not all of us, but a lot of us. Depending on what the situation is with how the person died, what the process of their dying was it something like when my grandmother died of a quiet little heart attack at 95, I was sad for a little bit, but it was okay, right? When my father died of suicide unexpectedly when I was 13 years old, I was not okay. Right. So we have to really look at what the individual specifics are. And it may be something where one loss triggers a whole bunch of other release of trauma or grief, other losses, other things that are sad in that person's life. And so then we have to deal with all those things too.
Yeah.
And then what about, I think it's really interesting because I never knew until I went through it myself, when you're having chronic, I don't even know if I'd call it health issues, but it's affecting your health. Like I was having a lot of hormonal issues, and now I'm finding that it might be even breast implant issues, whatever it might be, but where within the last 5 years, I basically have missed like a year and a half's worth of activities because of having to cancel. And when I went to a therapist about it, they're like, you're grieving that lost time. And so what do you suggest for someone, because I know a lot of people now, it seems like now I'm knowing more people going through similar stuff where they're also, and now I'm able to go, you're grieving the time, or what you said, lack of not being able to do something.
Yeah, so dealing with that, I think, does require kind of a different orientation, because a lot of the chronic illness issues that people are facing now, and particularly I would say women in their 30s, 40s, 50s are showing up with a lot of hormonal issues, a lot of general endocrine issues, things like hypothyroidism, autoimmune stuff, which would be the Hashimoto's, fibromyalgia, Sjogren's disease, those kinds of issues. A lot of that stuff is complicated, and it's still substantially dismissed by the traditional medical community. So right there's a huge invalidation that goes on. And unfortunately, with it being women's diseases, even though men get all of those diseases too, we tend to face a little bit more of that. And we're also expected to go on doing all the things that we're supposed to be doing, whether it's running a household, managing children, going to work.
Yeah.
There is a lot of grief about not being able to be full force about all of those things, whether it's missing events with your family and friends because you're really exhausted on Friday night and now you really need to go to bed at 9 p.m. instead of start getting dressed to go out at 9 p.m. Or it is taking time off from work and then you don't have vacation time because you've used it all up being sick, or you can't have children, or a million other things that are potential losses associated with that. Any disease that has any disfiguring element may make us fearful about dating, sexuality, intimacy. We want our bodies to be perfect. We're taught that that's what they're supposed to be. And illness really destroys that. And it takes time to adjust to that image and that reality of experience.
Yeah. And then aside from that, what they're dealing with physically, there's also grief that can show up in the physical body.
Mm-hmm.
Can you explain that?
Sure. It's quite well established at this point that trauma, particularly trauma endured by children, over time usually results in some sort of physical illness. So there is a big study you may have heard of. It's called the ACEs, Adverse Childhood Experiences. It's a 10-question scale. You can find it online, all caps, ACE. It was conducted by Kaiser in San Diego with probably about 10,000 people. They were noticing some patterns among people who had also reported trauma in their medical histories. And what we found is that people who grew up with childhood abuse, suicide loss, homicide loss, divorce, a mother that was beaten, or other forms of intimate partner violence, those children grow up to have trauma stored in their bodies, and it often manifests in autoimmune disorders, earlier diagnoses of diabetes, triggering of autoimmune conditions, triggering of hormonal irregularities, pain disorders particularly, and of course addictions and eating disorders show up. So a lot of things have their roots in trauma. We use the phrase "the body keeps the score," which is derived from Bessel van der Kolk, who's a famous traumatologist. That's really true. So it's not that I have a hammer and so everything is a nail, but when people come to me, they've kind of started to figure out usually that probably something about their bodies is linked to their emotional condition. And so they're seeking help with that.
Yeah. Well, I've always believed that too. I always believe mind, body, spirit, it's all connected.
Mm-hmm.
Okay. All right.
Absolutely.
And yeah. So when you can heal the trauma, your physical body can heal too.
Yes and no. So
I've seen it happen. So yes,
Yes.
I believe it.
Okay.
But what is your no? Tell me about the no part.
My no is that just believing it's possible doesn't always result in complete healing. There are diseases and disorders that have a genetic component. So we have environmental factors, we have traumas, we have genetics, and you can heal a lot of the manifestations of disease. But for example, I have type 2 diabetes, and one half of my family all died of complications of early type 2 diabetes. I can't fix that history, right? But I can fix everything else physically, emotionally, to the point where there's limited to no manifestation of the disease on a lab test, right? So we can't erase our histories. We can't erase our genetic inheritance.
Yeah.
But we can do a lot to clear that out. And I do believe in miracle healings also. I mean, I think they happen sometimes. People just have spontaneous remission.
Mm-hmm.
Ah, okay. I believe in that too.
And it said on your website that you use some unique different methods also. Like I remember, so you're talking now about like miracle healing and, believing in also the emotional aspect of it. Talk about some of the other things that you do that are a little bit different and outside of the box from others.
Okay. So just to preface this, obviously I'm not a medical doctor and I am not a spiritual healer. What I do bring in, though, is holistic and integrative work and a lot of nutrition science and movement related things. So, and Buddhist psychology as well. So I've been studying those things, and my family was doing a lot of things with dietary stuff. And I learned transcendental meditation when I was 10 years old. I bring in all of those sorts of things because I really don't think that Western medicine is complete enough for the kinds of illness that we experience. And it's miraculous. It saved my life a couple of times. It saved a lot of other lives. If you're in crisis, go for the Western medicine. A lot of these things, though, are more spiritual disconnections. So I bring in aspects of spirituality. Many times people are having a spiritual disconnection, which is really kind of a global empathy disconnection. And so our disconnection from other people can contribute to our illness. I may look at doing things with Ericksonian hypnotherapy, specific types of meditation. I may provide education about elements of nutrition that are missing or that could be altered or could be affecting mental health or mental illness. So I really, if I was going to put a label on it, would say it's holistic and integrative psychology as a practice.
Okay.
I love that.
Yeah. And recently you posted nearly 50% of adults have a chronic illness in which most are invisible. And this can cause anxiety and trauma. Can you talk about this and some of the ways that we can overcome or cope with this and be compassionate to others when they're dealing with it?
Yeah, I posted that recently because there are any number of weekly, daily, monthly recognitions of various diseases. And there actually is a chronic illness awareness week that comes around every year. So the deal is that around half of adults have one or more chronic illnesses. Those range from the big stuff like cancer all the way on down to, oh, you have a little high blood pressure and you take a pill every day and it has almost no impact on your life, basically. But we tend to idolize the perfect, healthy person. Half of us aren't there. And so we have to be mindful of that because the various illnesses that people have will contribute to anxiety, depression, sometimes to addiction. People are self-medicating, contribute to a lot of anxiety. Just something like Hashimoto's thyroiditis, which is hypothyroidism, can make you look depressed, can make you look anxious if your medication is not perfectly calibrated. And a lot of other symptoms of those sorts of things. Epic levels of fatigue, so many people with pain issues. You don't see any of that. They may report it, but for example, if you were to look at me, you'd say, oh, she looks perfectly healthy, maybe a little pale today, but healthy, right? The reality is I'm a chronic illness patient, and there's nothing visible about that other than at the moment the tape on my ankle that I injured, right? Most of the time there's zero visibility around it. We need to be mindful that when people say they're tired or they're in pain, they're probably about 3 times as bad as they say they are. Most people are struggling really hard, particularly younger chronic pain patients. They will try and push through. People also want to have the life they desire, right? We all do. Getting out and doing activities. Maybe they're having a good day. We need to remember that most of their days are not necessarily good days. And just because they were capable of doing something one day, that doesn't mean they're capable of it 7 days a week. So we can help by being mindful, aware, asking questions, even if we're not seeing anything, being attuned to other people. You know, if I'm really short with you, there's a decent chance that my ankle is killing me right now, for example.
So instead of calling you a bitch, we would try to have some compassion and ask, how are you feeling today?
Exactly. What we can do also, all of us, I prefer, have a real answer for that. Instead of saying, I'm good, I'm fine, say, you know, I'm pretty good, but I got to tell you, you know, that thing I'm having with my right wrist is flaring up today and it's really annoying and it's kind of limiting.
Yeah.
If we would all start to have more answers like that, we'd have deeper connections, we'd have deeper awareness,
Yeah.
and we would all be able to be a little more mindful that it's not just the elderly or people who use wheelchairs who have various levels of ability and disability.
I think that comes with acceptance of what you have going on, and no, letting go of the concern about what other people think, being a downer. Yeah.
Yeah, you know what? Speaking of that, like, how do you, even with grief of a loved one, or what we're talking about with the chronic invisible illness, how does one stop feeling like a burden?
Yeah.
Because even for someone grieving a loved one, they'll go, "Oh gosh, I'm being annoying. It's been more than 3 months or something." And it's like, well, no, who says there's a timeline?
I think frankly, we need a societal change around that. But what I would say about that, and what I try to educate people about, is in addition to it being a nonlinear process, there really is no time frame. We have this false idea that a year is the appropriate time to be grieving. And it's true that there are in many cultures rituals that coincide with a year. And it does tend to take around a year for the most part to go through anniversaries, birthdays, special events, holidays, and really noticing and feeling that absence quite acutely. But we need to be open to the idea of allowing ourselves to be as we actually are. We feel really pressured to all of a sudden bounce back. If you work for someone else, you probably have a maximum of 5 days of bereavement leave for losing your spouse or a parent or a child. There is no way you have stopped grieving in 5 days.
No.
There's probably no way you're even remotely competent to be back at work if it's a work that requires any sort of planning, organization, strategy. Maybe you could go back to, washing dishes or something mindless. But it is something where we need to also recognize that all of us go through the grief experience at some times. And all of us will most likely go through it many, many times. Therefore, it's not an abnormal experience. Being sad is also not a pathology. It's normal to go through periods of sadness, particularly when we have a loss. And there's sort of a, cult of toxic positivity, I would say. I am an eternal optimist. Absolutely. And I get sad. And that is okay.
Yeah.
Totally.
Very healthy. To have
Trying.
That. Yeah.
Process.
Well, you sound the words you're using to describe it are very healthy. But I'm sure it's another thing to actually continue to practice it daily.
I would say for me, it is very well practiced, very well educated. It's a priority, and I do all of the things to support being well. So it's real. Anger to illness or death. You have no idea how to actually deal with those things effectively when you are on your own. And a lot of times what happens with people is that they do find drugs or alcohol or other ways of escaping their feelings. And so I think that is, at the risk of enraging all the parents in the audience, I think it's a disservice to children to not expose them in a managed way to the realities of life. And I would say I had parents who were not conscious of that, but they exposed me to all of those realities of life anyway. While it is difficult and it was traumatic in many ways, I have some of the greatest resilience of anyone I've ever met, because very early on, I was taken to see aging relatives who were bedridden and dying, people in the hospital who were dying. There was no sugarcoating. Barbara has lung cancer because she smoked 2 packs a day. That's a lot of information for a 7-year-old. But it really was something where I didn't believe that it was all just happy times. And I don't think that's a realistic perspective on life. Similarly, kids need to learn things that are practical and not fun.
Yeah.
Totally.
Matter of fact, yes.
I'm extremely practical.
Yeah. No, I'm so big on non-sheltering. So
Yeah, I mean, I used to do that. I used to coddle my kids and rescue them when they were
Mhm.
little because I had the opposite growing up.
Mhm.
I didn't even have the awareness that I was doing it and that it was
Mhm.
harming them. And then my older one happened to tell me later when she realized it, you can't keep doing this. And I had to make some changes and it's for the better, so much better. But
Yeah, my experience in starting to shift people's awareness around that is for not not exactly joyously embracing all of the difficulties of life, but gratitude around someone being willing and able to talk about it and to take them through their emotional experience of starting to know these things. People would rather that we show up during difficult times than to be completely sheltered from them. We
yeah.
always know on some level that something is wrong.
Oh yeah. Yeah, then they feel lied to if it's not
Mhm.
discussed. Yeah. Yeah, and it also helps them, I think, to become emotionally intelligent,
Yes,
which is
yes,
so
definitely,
important.
definitely.
Yeah.
Thank you for listening to Talk Purpose and Truth podcast. Find out more at talkpurposeandtruth.com. And follow us at Talk Purpose Truth on Instagram and Facebook.